Welcome back to my channel. Now today's presentation is part 4 of nursing practice questions and answers about musculoskeletal problems in the adult client. Now let's start with the first question. A client being measured for crutches asks the nurse why the crutches cannot rest up underneath the arm for extra support. The nurse responds, knowing that which will most likely result from this improper crutch measurement. So these are the options. Option A, a fall and further injury. Option B, injury to the brachioflexor nerves. Option C, skin breakdown in the area of the axilla. Option D, impaired range of motion while the client ambulates. The correct answer for this question is option B, injury to the brachioflexor nerves. Now let's move to the rationale. Crutches are measured so that the tops are 2 to 3 finger width from the axilla. This ensures that the client's axilla are not resting on the crutch or bearing the weight of the crutch, which could result in injury to the nerves of the brachioflexors. Although the conditions in options A, C, and D can occur, they are not the most likely result from resting the axilla directly on the crutches. Now let's move to the second question. The nurse is caring for a client being treated for fat embolus after multiple fractures. Which data would the nurse evaluate as the most favorable indication of resolution of the fat embolus? So these are the options. Option A, clear mentation. Option B, minimal dyspnea. Option C, oxygen saturation of 85%. Option D, arterial oxygen level of 78. The correct answer for this question is option A, clear mentation. Now let's move to the rationale. An altered mental state is an early indication of fat emboli. Therefore, clear mentation is a good indicator that a fat embolus is resolving. Eupenia, not minimal dyspnea, is a normal sign. Arterial oxygen level needs to be 80 to 100. Finally, oxygen saturation needs to be higher than 95%. Now let's move to the third question. The nurse has conducted teaching with the client in an arm cast about the signs and symptoms of compartment syndrome. The nurse determines that the client understands the information if the client states that they will report which early symptoms of compartment syndrome. So these are the options. Option A, cold, bluish colored fingers. Option B, numbness and tingling in the fingers. Option C, pain that increases when the arm is dependent. Option D, pain that is out of proportion to the severity of the fracture. The correct answer for this question is option B, numbness and tingling in the fingers. Now let's move to the rationale. The earliest symptoms of compartment syndrome is numbness and tingling in the fingers. Other symptoms include pain unrelieved by opioids, pain that increases with the limb elevation and pallor, and coolness to the distal limb. Cyanosis is a late sign. Pain that is out of proportion to the severity of the fracture, along with other symptoms associated with the pain, is not an early manifestation of compartment syndrome. Now, in my presentation, my reference book have used Saunders' Comprehensive Review for the NCLEX RN Examination 9th edition.